Good morning, Terry.
Good morning.
How are you doing today?
I'm doing okay.
All right, so you're here for your normal outpatient meeting
Mm-hmm.
after your depression a few months ago.
Mm-hmm.
Are you feeling better?
I feel like I'm doing better than I was last time I saw you. So.
Good. All right, well, we've talked a little bit about your smoking in the past,
Mm-hmm.
but I was wondering if today you'd be comfortable talking with me a little bit more about that.
It's okay.
Okay, great. Well, first of all, I know that you smoke, but I don't know exactly how much. Could you tell me about how much and the pattern of your smoking?
I smoke about 2 packs a day.
Okay. Is there any times where you smoke more or less?
Um, it's pretty regular kind of throughout the day. Usually pretty early when I wake up, and I feel like I probably maybe smoke a little bit more when I'm at work or a little stressed out.
Okay. So when you're stressed and uh, just regular breaks throughout the day.
Yeah.
Okay. And how long has that been going on?
So I was 14.
Okay, so about 10 years.
Mhm.
Wow. Um, do you feel like that impacts your function at all?
I mean, a little bit. I feel like
Can you tell me how?
I, I mean, I feel like I had like a sinus infection, and I've had a little bit of difficulty breathing lately. But I feel like it may not even be from the smoking.
Okay. Would you be all right if I offered you some advice and a little bit of education on the subject?
Sure. I mean, you're a nurse.
Wonderful. All right. Well, your shortness of breath and your respiratory infections, they could be from something else, but those are also very common symptoms of acute smoking.
Mm-hmm.
So that, along with your asthma, could probably be reduced significantly if you were to stop smoking.
Mm-hmm.
Then there are some other long-term effects. You can be at more risk for heart attacks, strokes, lung cancers, and other cancers. Um, uh, COPD and bone density problems.
Okay.
So there's a lot of other risks involved as well. It's, of my opinion, and concern for your health, that it would probably be best if you were to cut down and stop smoking.
That's what a lot of people say. I mean, I don't know. Like sometimes I think about it, but I feel like I've been doing it for a long time. 10 years. It's just kind of a part of who I am.
Okay. Do you feel like you would have to change your life significantly then if you were to change that too?
Yeah,
You feel like it's a part of who you are?
in a way, I guess. It's something I do every day, and I've done it every day for 10 years.
Okay. Well, can we talk about the pros and cons of stopping smoking for you?
That's fine.
All right. So what are the pros of you smoking?
It's something I like doing. It gives me something to do. It's a little social. There's usually sometimes someone taking a smoke break, and you just chit chat, and kind of like helps calm my nerves and relax me.
So you feel like it's a icebreaker and a coping mechanism a lot of the time?
Yeah, it just keeps me calm.
Right. What are some of the cons of your smoking?
Um, I it's not very good for you. My dad used to smoke a lot. He passed away from lung cancer.
I'm very sorry to hear that.
It happened. So maybe I could get cancer. Not really that concerned about it right now. I feel like I could maybe quit before then. I Some people say it smells bad. My last girlfriend broke up with me because I wouldn't quit smoking.
Oh.
And I've got a niece also that I really like hanging out with. but my brother doesn't really like me being around when I smoke.
Okay. Well, it sounds like relationships are really important to you. You talked about having conversations with people and your dad and your former girlfriend and your niece and your brother.
Mm-hmm.
But it sounds like smoking causes issues in those relationships.
Yeah, like they're just kind of not okay with it. So it'd be nice to not have those problems.
What would be some pros to you stopping smoking on that topic?
Well, I guess I wouldn't have so much trouble maybe breathing if that's related to smoking. I get to hang out with my niece more often. And I feel like maybe it'd be a little bit more bearable for, people to hang out and with me, ride my car, or whatever. So.
True. Are there any cons to you stopping smoking?
I feel like it's something I'd probably miss, and probably be easier for me to get stressed out and depressed again. So.
Okay. Well, you've done a really good job with your behavioral changes and your coping mechanisms that you've developed after your hospitalization. And I think that you could definitely come up with coping mechanisms to move past this too.
Mm-hmm. Thank you.
No problem. All right. So I have this scale here that goes from 1 to 10.
Mm-hmm.
And on it, I'd like you to tell me from 1 to 10 how important you think it is for you to stop smoking, with 0 being not at all important and 10 being the most important thing.
I'd say it's probably a 3.
A 3? Okay. Why wouldn't you say a 1 or a 2?
Because it is something I do want to change at some point, because I want to hang out with my niece more, and, my dad did pass away from cancer, and so I guess that's something that could happen to me.
Okay. On this same scale, how would you say your confidence is that you can change?
Probably a 2.
A 2? Okay, why not a 1?
Because I feel like it is within me to make the change. I just don't really feel like I want to right now.
Okay.
So.
You said that earlier. You said that you feel like you can stop smoking before you get to develop cancer, like your father did.
Mm-hmm.
When do you think that would be?
Maybe. I was thinking like maybe 10 years, but we've been kind of talking about like all the health problems, and maybe it'd be better for me to quit a little bit sooner.
Yeah, especially since you're already experiencing some of the health problems that are associated with smoking.
Mm-hmm.
And young people can develop lung cancer. You said your niece is important to you. Do you want to have children of your own someday?
It's something I've thought about. I think that I would. I like my relationship with my niece, and just seeing that relationship between her and my brother kind of makes me feel like I'd maybe be a good dad. So.
All right. Well, I certainly hope that happens for you. But smoking can impact your fertility also.
Mm-hmm. So
the sooner you quit, this might be a bit too much information, but your sperm counts get better, and
mm-hmm.
The secondhand smoke also has an impact on developing fetuses. So if you're around someone who's pregnant, that can impact their health as well.
Mm-hmm.
So that might be another good reason to quit.
That's true.
So we've talked about some reasons to quit, and I think we've helped a little bit with your motivation.
Mm-hmm.
Could you point out to me on the scale of 1 to 10 how ready you feel to quit?
Maybe like a 5 or 6.
That's wonderful. I'm glad to hear that. Why not a 2 or a 3?
I feel like you kind of brought some things to light and kind of highlighted some of the benefits of smoking, and made it seem like it's something I should actually do. So.
Okay. Well, it's usually easiest for people if they stop cold turkey, because when you're smoking 2 packs a day and you go, when you stop smoking, you're going to have some withdrawal symptoms, which I'm sure you're aware of. You might experience them if you go too long between cigarettes now.
Okay.
And those will peak within 1 to 2 weeks, and then they may last for a couple months. So it's usually easiest to quit right off the bat, and then you get through your withdrawal symptoms quicker.
Okay.
Would you be comfortable making a plan with me today
Sure.
on when you'd be able to stop smoking?
Yeah.
All right. Would you think that in 2 weeks from today you would be able to be completely...
I think I can try.
All right. Wonderful. Well, in that case, I'd like to schedule a follow-up appointment so we can talk about how you're doing at that point in time,
Okay.
and maybe discuss some of the symptoms you're having and all that jazz.
All right. Thank
Wonderful.
you. I'll see you in a couple weeks.
Great. Thank you.